Today, the District Health Society Kamjong, in collaboration with the all Tangkhul Medicos Association, ATMA, is organizing a 2 days free surgical camp at CAC Kamjong. The need for this camp was because there are so many people in this region who are living below poverty line, and many of them are facing it very difficult to access healthcare at other districts and in other tertiary health facilities. It is because we don't have the facilities to conduct such surgeries in Kamjong CAC, because we don't have any specialists, no surgeon, no anesthetist, and we have got gynecologists. But then since we are not having us anesthetists, it is very difficult for us to conduct even surgery, gynecological surgery also. Another reason is we are conducting this free camp in collaboration with ATMA, because to conduct even small minor surgeries also we need equipments and other consumables to cater to the need of the surgery. But that also we are not having it, and because of all these difficulties, we are not able to provide services, healthcare services to the people of Kamjong. But seeing the need of the people, we are today organizing this 2 days surgical camp with the help of all the surgeons coming all the way from Imphal, Ukrul, from different institutes who are working in different institutes to help out to help the suffering of the people of Kamjong. And so today we are conducting 45 minor surgeries, 4 major surgeries, which included 2 gynecological surgeries, a total abdominal hysterectomy and an ovarian cystectomy, 2 appendicitis, and this is the 49 surgeries altogether we are conducting in these 2 days. This will definitely ease the people of Kamjong, because in spite of them having health cards, they are not able to go down to Imphal because they are not able to afford for the transportation, which is very expensive. Coming from Kamjong to Imphal, it costs more than 7,000 to 10,000. They cannot afford the accommodation in Imphal or Ukrul, nor for the fooding expense. So all these out-of-pocket expenses, since they are not able to afford it, the people have been suffering in silence. So we feel that the need for conducting such type of surgeries even in the days to come, but for that we need our infrastructures at the CAC to develop. We need surgeons to be there in our health facility, especially at Kamjong being a CAC being located in the district headquarters. We want our infrastructures to be upgraded. CAC Kamjong was upgraded to a district hospital in 2017, but till now it is functioning at the level of a CAC with only 4 doctors, 1 nurse and 1 ANM. There is no technician, no microscopist, and then we don't have any dental surgeon also. So with all these facilities being not available, it is very difficult for us to cater a maximum service to the people of Kamjong. So I appeal to all the persons who are concerned to kindly help us out, the government to help us out to build up our infrastructure to the level of a full-fledged district hospital in the days to come.